Well, happy Women's Health Week.
Happy Women's Health Week.
Happy Women's Health Week.
It's nice that they're recognizing it now.
Yes, definitely.
That's important.
Yeah.
And we do deal with a lot of women's health issues at St. John's.
We do, yeah, and I love the fact that we get to deal with it together as a group, right?
Correct.
I think it's so empowering that it's just like a group of women taking care of women's issue.
Yeah.
Yeah. I love it when we're all in the OR together. It's so fun.
Me too.
Well, I think it's just so important that we recognize like women's issues aren't just things that we can take care of in silos, right? For a very long time, medicine has been like that. Like breast cancer, we just take care of the breast cancer. You know, urologic cancers, you just take care of that. But it's a whole person, right? And there are so many unique things about the individual that may change what you want to do. And I love the fact that when something does come up, I get to call one of you guys because it's obviously outside of my specialty, and being able to lean on you guys for your expertise to help this whole individual is so great.
And I think that the part that is nice that we pass back and forth is just sort of the focus on quality of life. I think that's one of the things at St. John's we do really well. And I know that if I have a quality of life issue with a patient and I hand them to you, we're going to pay attention and take care of it. And I think that for women patients in particular, I think women tend to assume that quality of life is optional and we just have to get through things. And so I really love that we can focus on that for them, stop and address it.
And talk about it.
Yeah.
Like how many of your women patients just feel like they just have to power through whatever you tell them to do?
All of them, really way too many. And not even that they don't even recognize that it's not normal. I think that it's almost like you need to re-educate them what we normalize,
right,
and what's considered potential like a health problem.
Right.
So you would, the number of times that patients are completely okay with having an abdominal or pelvic mass that is visibly palpable, and they just think, oh, it's just the way that it's always been. And you know what? The number one thing that they always tell me, like, didn't you notice this before? They always say, the first thing is always, oh, I just thought I was gaining weight.
Yeah.
So I feel like they always, whenever they sense something wrong, they always turn it internally to
blame it on
themselves.
themselves.
Somehow it was your fault.
I ate too much over Christmas and I just thought I was gaining weight.
Or my favorite one is, I'm getting older, so I thought that's what's supposed to happen with your bladder. No, that's not what's supposed to happen with your bladder.
That's not what happened.
So there's like a philosophy, and especially in gynecology, like if women are not complaining about it, or if they're asymptomatic, you leave it alone. There's so many even benign pathologies that just like miss this window of opportunity for meaningful clinical treatment because we just completely leave it up to the woman, which is absolutely valid as long as there is proper education and conversation. But if we most of the time it just gets ignored. That's what happens until it's unfortunately too late.
It's unfortunate, but I love the fact that we at St. John's really focus on the women. We ask the questions, right? We ask how they're doing. We ask how it feels. We ask what are our treatments, how is it impacting their lives, and that's unique because that really kind of is the focus of St. John's. It's the individual, right? About how they're doing and not just how the cancer's doing or not how their vagina's doing, or it's so important to take care of that whole person.
Yeah, I mean, I feel you ask your patients questions about their bladders and their urinary function, but you know that when you refer them to me, I'm going to take care of them the same way that you would. And that's one thing you don't have to worry about, right? But then you don't have to deal with all the urinary issues. You just say, I'll go see Jen, she'll take care of all your urinary problems.
Got the perfect person for you.
Yes. And if I see patients, I'm like, did you get your mammogram? And they're like, no, I didn't. I'm like, well, I'm going to order it for you. And then I get it and I'm like, nope, I don't know what that means, but I'm going to send you to Janie and she can tell you all about it.
Yep.
So
it's nice to have friends you can lean on.
Yes. But you don't have to know everything about everything, because I think that feels overwhelming as a provider sometimes. You don't have to be responsible for all the problems. You can be responsible for what you actually can really help with, and then know that you can send them on to good people.
And have continuity of care and pass people back and forth and make sure the doctors are talking to each other, which I think is indispensable when you're talking about treating women, because they don't always advocate for their own care. So I think it's really lovely when the doctors talk, whether they're male or female doctors. I think that really facilitates good care for women.
That's when, disjointed care, that's where you miss things, you know, and that's, you know, we don't ever want to miss anything. And so being able to communicate with each other so easily here at St. John's really makes that easy. So I think we're very fortunate to have that team effort.
Do you feel that the changes in hormones causes a lot of the stress and anxiety you see, or is it just the cancer?
I feel like, you know, women are always dealing with flux in hormones, and so we get kind of good at that. So I really do think that part of it is just the fact of cancer, the fact that your mortality is very close to you for a minute there. You know, God willing, we'll take it away from you and you'll get better. But unfortunately, a lot of times, you know, we take your hormones in the process. And then that's a whole other adjustment, right? And we know that the hormones affect every body system. So they're going to affect your vagina, they're going to affect how you're able to pee, they're going to affect the way you think,
your bone density,
and so it just feels like a really big change to every body system. And I think if we make it easy for them to get care for all those body systems and make it less of a burden, I think that's the nicest thing that we can do for someone who is going through this massive life change.
I agree. Your patients with breast cancer, how often are you referring to Dr. Park, you know, to have ovarectomies or?
I mean, luckily we have a great genetics program, right? So we can actually do the genetic testing to see if there's actually a risk, right? A lot of people think you get breast cancer, so I got to get my ovaries taken out. Well, no, you don't have to have your ovaries taken out if you don't have a BRCA mutation. So it's, again, having that genetics team right there really helps us stratify who's at risk and who is not. But then if we need to, she's right there. It's great. We can,
And for people who are on like anti-estrogen therapy, especially young patients who have a lot of atrophy-related, you know, pelvic floor or sexual health issues, it's if they have an established gynecologist or endocrinologist who is already helping them manage these symptoms, great. But if not, that's, you know, I love being able to be able to kind of step in and take care of, you know, our, you know, breast center patients. You know, it's, again, you know, being able to take care of everything internally. I think that's a really, you know, in a setting that's comfortable for them. And if I have any questions about, you know, hormones or, you know, their current, you know, breast cancer regimen, again, there's no delay, and I just knock on Janie's, you know, door and just confirm something, then I can, you know, help verify that with my patients.
I'm so happy that I have a chance to work with all of you. I feel very, very lucky. I think our patients are extra lucky. I feel like we've got our women patients covered from every angle. And all of us really care about our patients a lot. What did you say about putting your arms around the whole patient?
It's like we put this collective arm around our patients and give them this huge hug and make sure that they're going to be okay from head to toe.
Yeah, that's what we do.
So good job, ladies.